Hello and welcome to Healthcare Voices, where we bring you authentic voices behind healthcare innovation and impact. I'm your host, Katherine Cummings, former clinician turned healthcare technology advocate. And today I have the pleasure of speaking to Dr. Nick Hayward, a neuroradiology fellow and researcher in precision neuroscience. Dr. Hayward's medical imaging work focuses on understanding the brain not as a single organ, but as a dynamic network of regions that respond differently to injury and recovery. His research explores how daily physiological changes like sleep, exercise, and even sex differences can impact brain health over time. He is a passionate advocate for moving neuroscience innovation into clinical practice, and Dr. Hayward challenges the traditional mindset of treating the brain as a homogeneous entity and calls for a more personalized and individualized approach or precise approach to brain care. I'm thrilled to have him here to share how advancing brain care and brain science can transform patient outcomes and the future of healthcare. Dr. Hayward, thank you so much for joining me on the podcast today. I am delighted to be chatting with you.
Catherine, thank you so much for that kind introduction. It's just wonderful to be here, and thank you for the opportunity.
So, to kick things off, I would love for you to share what originally drew you to the field of neuroradiology and brain injury research.
I started life as a molecular biologist as a University of Cambridge natural scientist. I did my master's in molecular and cellular biology. And I was coming to the end of my master's program, and I thought, where do I want to share this learning best? And I realized that for me, I was most fascinated by the brain because the brain is relatively poorly understood. And this is going back around 20 years now, so a long time ago. And I think because it was so poorly understood, it became the most interesting. And naturally, I moved my research in the direction of neurosciences for my PhD studies. I was also keen on technology, though, as well. And I felt that in order for science to be relevant for society, it's just absolutely crucial to have technology that you can share with society. And I wanted to become a technologist at the same time. So it just made sense, like a natural harmony between neuroscience and technology is neuroimaging. The opportunity to use scanners, medical imaging to study the brain, both in research, but also in clinical settings as well. So that's kind of how I started to get into it after my research career. Neuroradiology came a little bit later as a clinical specialty because I actually went to medical school after my PhD. I came back to the UK. I'd been in Finland for my PhD, and I came back to the UK to Imperial College London, and I did my medical program there. And since then, I've done a number of different roles in medicine and healthcare, but specifically now, I've been able to bring my interests in imaging and clinical practice together by working as a doctor in neuroradiology currently. And I think, in all honesty, the motivation is that these specialties allow me to share my own expertise as much as possible with society, because I firmly believe that when we do research or we develop technologies, they're really not of much value unless we can directly share them with society. And that's why, again, it's a great opportunity to talk to you today as well.
When we spoke before the podcast, you emphasized to me the brain's regional variation. I'd love for you to explain how the different areas of the brain respond uniquely to injury and treatment. And if you want to give an overview of, kind of the different regions of the brain too, I think that'd be really helpful for our listeners.
Sure, thank you. So there are many different types of brain injury and many different severities of brain injury. So let's start with some basics, some categories. Particularly in research, we tend to focus on really two types of injury. Sometimes we look at penetrating injury, which is severe, of course, where the head itself is broken in some way and the brain is injured directly. But there's also a lot of research, and my research is more associated with closed head injury, so an impact to the head and to the brain. And I think what we've learned about the different regional responses in the brain will vary depending on injury types, depending on people, depending on demographics, and so on. But I just wanted to start with that overview that my background, my expertise is more in closed head injury and traumatic brain injury in that sense. Now, clinically, as you've kind of hinted at, we tend to look at the brain as sort of one organ in one entity, and we'll come on to some reasons about that. But my own research, and much research subsequent to that from others, has demonstrated that the brain is made up of many different moving parts. It looks like one homogeneous entity, but actually there are many different areas that have different roles and responsibilities. And what happens is that different areas of the brain talk to one another through a process called connectivity. And there's signaling between these different areas of the brain. Now, what we notice in brain injury is that if, for example, you have in a closed head injury, you have an impact to one area of the brain, and that creates a contusion, if you like, or a bruise in that location. Different areas near that will respond differently subsequently. For example, the area itself may be very damaged and unable to form any sort of recovery. But what my research and other research has shown is that areas surrounding that region, in, for example, the cortex or the cerebral hemispheres, may respond by increasing blood flow or blood volume to that area, almost in a bid to try and aid recovery. And we see this both acutely and in the long term as well. Now, in addition, those areas of the brain surrounding the site of injury might also demonstrate an increase in vascularity, i.e., new blood vessels may come along and try and help in the recovery process as well. Now, interestingly, if we look beyond the area where the injury has occurred and we look to perhaps deeper brain structures, for example, one named the thalamus is an area of the brain that's responsible for many different functions, kind of thought of as the central processing unit of the brain. When we look at the thalamus response after closed head injury, we can see that, again, there are many studies on this, not just my own research, that the thalamus will undergo a degree of neurodegeneration, even though it's very far removed from the site of injury. And this is fascinating. And there's a lot of reasons to speculate why this might happen. For example, we think that the thalamus, or the deep structures in the brain that are really important for the fundamental activity of the brain, they may change because they are, of course, connected. There will be these long connections of the brain cells from the deep structures to the higher structures. And there was a recent review paper in, I think in 2023 that I read recently. And this showed that some of the regional changes that occur in the brain, the fact that they're different in different parts of the brain after injury, might be to do with the fact that the glial cells become activated or inflamed after injury. And the glial cells are interesting. They're a wonderful bunch of cells. They don't get anywhere near enough attention as the neurons. But the glial cells form the scaffold of the brain, if you like, and they provide many different functions to create appropriate regulation of the neurons and other cells in the brain. And this review paper I was literally reading recently, far more recent than my own research, it brought together studies from the field, and it described how there's good emerging evidence to suggest that it's the glial network that becomes activated and busy, if you like, to kind of coordinate regional variation responses in order to optimize recovery or to perhaps minimize secondary damage after brain injury. So it's fascinating because what we thought of as perhaps one homogeneous entity years ago is now becoming better understood as an organ with many facets and many different processes. And in all honesty, this understanding is very much in its infancy. There's a long way to go in terms of elucidating these understandings even further.
It's so wild to me that we have data that shows that different parts of the brain respond differently to treatment, and different parts of the brain are impacted when there's injury, but we are still kind of looking at it as that homogeneous entity that you discussed. You see that especially with stroke patients, I would say, when one piece of the brain is affected. And for example, my father had a stroke and he doesn't have any peripheral vision on his right side. He has some memory issues, things like that. But the fact that we are still looking at it as this homogeneous entity, when we can very clearly see that when different parts of the brain are impacted, it affects very specific things for that particular patient, is just kind of really interesting to me. And that kind of, leads me to my next question, actually. So why do you think clinicians have historically treated the brain as a homogeneous entity? And what do you think the consequences of failing to recognize that the brain's internal diversity in a clinical practice is negatively potentially impacting clinical practice and wellness, brain wellness?
Sure, thank you. Well, there's lots to unpick there. But firstly, I must stress, I'm sorry to hear about your relative, but actually that as you've beautifully highlighted, that the way our brains respond is very individual, and it's very, as you say, very specific to every patient. And as you highlighted, and I know from your own work, that neurorehabilitation has to be kind of individualized. And I think I'd be glad to talk a little bit more about that later. But it really highlights how the brain isn't just one entity, and that many different areas of the brain will have different functions, and that we can optimize. Ideally, we would like to be able to try to optimize the functions of certain areas as best as possible, and that perhaps requires a tailored approach. One good example in that regard is how some stroke patients may not be able to speak very well, or if at all, after their injury, which is absolutely devastating. However, some of them may be able to compensate with singing, because the areas of the brain responsible for singing are different to the ones for just the general spoken conversation, which I find fascinating. I mean, you think it would be similar areas of the brain. And again, mechanistically not very well understood, but illustrates in the example you gave how we all respond and recover differently, and we can perhaps compensate for certain things that we've lost. Coming back to your question, so the homogeneous entity, as I say, and as we say, it's probably because if we think about how we manage therapy for the brain, whether particularly, perhaps if we leave surgery to one side for a second, if we look at medical therapies, we typically have 2 ways in and 2 ways out with the brain. So way number 1 is the cerebrospinal fluid. So this is the fluid that surrounds the brain and also the spinal cord. But it's quite invasive to enter the cerebrospinal fluid, to perhaps give medications or drugs or therapies to that route in order for them to spread around the brain. And even if they do, they tend to spread around the whole brain. And that's one way in, one way out. If we were to give medications through the second route, that would be via the bloodstream. But the brain has something very special in its blood supply, and that's something called the blood-brain barrier, or BBB. Now, this barrier is essentially specialized cells that line the blood vessels and create quite a selective barrier between the very fragile brain tissue and the blood supply itself, allowing the bad stuff out and the good stuff in, and being very selective in that way. And of course, this blood-brain barrier is all around the vascular supply within the brain itself. Consequently, clinicians haven't had too much opportunity to be very selective or targeted in their approach to therapies. If we give drugs via the bloodstream, or if we ingest drugs or inhale them, medications are then moved towards the brain, of course, naturally through the circulation. But in order to be able to treat specific areas, well, we just haven't really yet developed many medications that are so specific or selective for certain areas. Coincidentally, we often, as medics, myself included, will treat the brain as a single unit. The other area of this, the second key point on this topic, is to consider that when we look after patients, and I know you've some experience in the intensive care unit, for example, and I've seen myself firsthand in neurointensive care how we look after patients, we really just have to provide the best supportive care possible to manage the entire patient's physiology. And it's very difficult to intervene in any sort of way where we could perhaps prioritize looking after one area of the brain. We just really have to look after the whole brain. And the way we do this, and where the technology is at, is that as clinicians, we do have to focus on the whole brain in entirety. And that's not necessarily a bad thing. But of course, as you highlighted, there are some missed opportunities by failing to recognize that the brain actually is more complex than a single entity. And I think what we perhaps are missing, to come on to the second point of your question, we're missing opportunities to be very precise and targeted in our therapies. To come right back to the example you gave of your relative who'd had stroke, it's that would be a unique opportunity to target the territory or area that was most affected. But it's very difficult to do that selectively at this stage. And I think that those are the opportunities we're missing, perhaps in the early stages after a brain injury, whether that's traumatic brain injury or stroke or epilepsy. We're missing those opportunities to provide targeted therapies. And I'm optimistic for a future of precision medicine and personalized healthcare. We're not there yet, but a future in that direction will allow optimized, individualized recovery plans for our patients.
How can understanding the brain within that broader context of the entire body, rather than in isolation, transform our diagnostic and treatment approaches for some of these patients?
Wow, it's a big question, but let's give it a go. So I would say that my own research, recent research, is focusing in this direction. I'm passionate to say that we need precision neuroscience. So what's precision neuroscience? Well, this is a relatively new emerging field where we really aim to link up our understanding of that brain connectivity, the signaling between different areas of the brain, and really measure and monitor that brain activity, but understand it in the context of how our physiology, our heart rate, our breathing, our blood pressure is changing. And also, the third component to this is how are these changes occurring in the brain and in our physiology in the context of our environment? How do environmental factors influence these metrics as well? So the question is, how on earth can we do this? I mean, that sounds outrageously complex. Well, what we've adopted is a strategy whereby we are starting to look not just at groups of individuals and seeing how brain changes occur in groups, but we're starting to do a deeper dive into research, and particularly just into one person over a very long period of time with multiple repeated time points. And we don't just do brain scans to look at the brain connectivity. Typically, that's done with functional magnetic resonance imaging or MRI scans. We don't just do those MRI scans maybe once or twice. No, we do multiple in one person as a research study over perhaps several in a week or several in a month over an extended period of time. And in addition, simultaneously, we collect physiological data from wearables. And that would include heart rate or breathing rate, and sleep. It's another one we can study quite conveniently with wearable technology. This will include sort of rings or watches, those kinds of technologies. And we also do surveys and evaluations of the environmental factors in play as well. And we combine all of this data. I've been working with some great data scientists, for example, Dr. Anna Triana, PhD. She's been brilliant in spearheading this kind of work with me, really supporting, to be honest. And what we've done is through data science that's really beyond my expertise, is to be able to look at the changes in connectivity in the brain, changes in brain activity in relation to changes in physiology and changes in the environment. And I think that's what's required to answer your question. So what this will hopefully enable us to do in the future is to better understand the interplay between our brains, ourselves, our environment. And why is this important? Well, ultimately, it will allow more precise diagnostics and opportunities not only for further research, but to really optimize our well-being. I'll give you an example of this. So this level of detail might be useful to identify moments of risk. For example, if we were to combine certain patterns of brain activity with certain physiological metrics in certain environmental settings, maybe that information could be used to predict whether or not that individual is at high risk of developing a mental health concern. Or potentially that information could be used to predict the progression of dementia or degenerative disorders. So I'm optimistic that although this research is at an early stage, in the future, precision neuroscience will not only be useful in treating disorders, it might help accelerate the new generation of preventative medicine, but also just optimize wellness. There's a real wellness element to this, and longevity, which of course are active areas of research, not for me personally, but also as well. So I'm optimistic that that hopefully answers your question, that if we can use precision neuroscience to be more predictive, not only do we have new avenues of research, but we have new avenues of optimizing wellness.
You know, we're seeing a lot of research going into longevity. And if you think about the field of research that you're doing and longevity and some of the other precision medicine, I almost view it like a Venn diagram where there's this massive overlap for longevity and precision medicine happening. But the question that I have for you is, what kind of risks do you think we face if we don't integrate the precision medicine research and those innovations into clinical practice or into clinical neuroscience?
Yeah, thank you. And there's a lot of risk because what we're currently doing, as we've already highlighted, is we're treating a lot of our patients with brain injury with very clear protocols and guidelines, and that's important. And I'm a strong advocate of doing so. I'm very much a clinician and scientist as well first and foremost. And that means that whatever we do, we need to do with robustness, with integrity, with safety in mind. And I think what I'd say is that we're missing opportunities, though, if we are unable to innovate in the space by being more precise in our diagnostics. I think we're really just missing opportunities to optimize therapy. We're missing opportunities to predict who's most likely to get what condition and when. And we're really just missing opportunities to bring healthcare technologies closer to patients, which is where they matter most. I mean, I've often been frustrated, if you like, in my career when I've noticed that some of what we can do in a research environment is perhaps streets ahead of where we might be in the clinical setting. And I've noticed this, I like to call it the divide. There's a real divide between where the research is at and the technology is at in a research setting, experimental setting, and where we are clinically. And there's lots of reasons for this, which we could go into, but it's a concern for me because I sort of feel like within even the span of my lifetime, I'm concerned that a lot of what many of us have been working on will not actually be realized and be of benefit to society. And that's the motivation. You know, I'm sat here with you today because I really enjoy sharing what we've been working on, but I feel like those technologies need to find a route, find a path to patients, find their way into the clinics. And it's a very long and challenging process. And that divide is something that really can be very difficult to cross.
Speaking of that divide, why do you think clinicians might be hesitant to kind of adopt those new findings and put it into clinical practice?
That's a great question. I think there are lots and lots of reasons. And I've actually thought about this divide for a long time because it's something I've been noticing for quite some years now. I'll maybe highlight just a few possible reasons as to why it can occur. And I want to stress that a lot of the reasons are very positive. There are good justifications for being slow or perhaps reluctant or diligent and careful when adopting new technologies. And I'm very much in that camp. The first thing to mention is probably when you think about any new technology or new therapy, and you know yourself as a clinician, if you bring that technology in, if you bring that technology into to clinical practice, the experts that use it will have to undergo some degree of training to the new way of doing things. And let's be clear, medicine in particular, as you know well, it's very much established on continuity, traditions. You know, you learn from your seniors and then you get the opportunity to become expert yourself, hopefully. And this takes a very long period of time. And to come along and reinvent the wheel with new approaches is never going to be straightforward, not just because the individuals themselves who use the technology might be reluctant or they may not be in a position to retrain, but those new approaches may not fit into the system. We all practice in healthcare systems internationally, and they're all different systems. And the complexities and nuances of those systems mean that it can be very difficult to just straightforwardly integrate new technologies into existing systems. And that's one of the other key concerns on this. A couple of other things to mention. Some clinical technologies don't always identify a very precise clinical need. And I've been guilty of this in the past, but when we're innovating, we think, oh, this is an exciting technology and I can see an application. But if that application doesn't necessarily truly address something that needs to change in healthcare, then it's possible that even if it's slightly better than what we already do, it won't likely be adopted on scale. And that's at a broader scale. So I sort of feel that sometimes we start developing new technologies with good intentions, but we don't always necessarily fully understand the need. Why does that happen? Well, often, I've worked with some companies as a medical technology advisor, and I'd say that a lot of companies I've spoken to just initially, they may have been developing their technology without actually directly interacting with the stakeholders it involves, which is a bit surprising, but it still happens. For example, they may not have engaged with the patient demographic who's set to benefit from this technology. They may not have already engaged with clinicians who work with the similar technologies already. So there are many different reasons. Hopefully I've summarized and highlighted a few of the potential reasons that explain that divide that I've seen frequently when looking at research and clinical practice, and why sometimes there's a divide between the two.
I'd like to understand a little bit more about how brain imaging technology has evolved over the last 2 decades. I know you said at the beginning of the podcast that you've kind of been in this field for the last 20 years. I'd love to know how it's evolved, how it's changed, especially in relation to brain injury diagnostics.
Gosh, well, I think a lot has changed in the last 20 years. Fortunately, despite there being a divide, I'm really pleased to say that there have been new technologies that are getting taken up in healthcare practice. I've seen a real renaissance in diagnostics and imaging. I mean, what a time to be researching and practicing in this space. Absolutely exhilarating, no exaggeration. Very fortunate, to be honest, to see what we're seeing. And every time I go to a conference, I see more exciting things coming our way. Let's bring it back to the topic of brain injury. So, as you asked, there's a mechanism of brain injury known as diffuse axonal injury. So let's just explain that briefly. Diffuse axonal injury relates to the axons. Axons are the large, almost cable-like fibers that connect up different areas of the brain and connect the brain to different areas of the body. They're essentially the long parts of the brain cells, so particularly the neurons. And they bundle up together to form almost like cables within the brain. And it's a bit of a simple summary, but that's just one way to imagine them. And what can unfortunately happen, particularly in rapid acceleration and deceleration injuries, for example, during a car accident, for example. Passengers in a car accident may undergo this injury pattern of diffuse axonal injury, and there are shearing forces that can cause really horrific damage to those white matter structures, these tracts and axons within the brain. Well, of course, as it's so devastating, the ability to be able to image the severity of this is a true clinical need. And what I've noticed over the last 20 years, right from when I was working in pure research and now doing a bit of both research and clinical practice, I can see that we've employed a new imaging technology called diffusion tensor imaging, or DTI. And this is a type of MRI, magnetic resonance imaging scanning, but it specifically looks at the white matter tracts, these really important cables that connect up different areas of our brain. And that's been a relatively new and very specific area of imaging development that's very useful for evaluating diffuse axonal injury in particular. But it's also useful for looking at areas of the brain that might be interconnected when preparing for brain surgery. So if you're going to intervene in the brain with a surgical approach, you may want to consider, what's connected to what. And actually, typically, patients who are being prepared for brain surgery, perhaps for, let's say, a tumor removal, they will often have a DTI scan. So part of their MRI scan, they'll have diffusion tensor imaging to look at these pathways in the brain, structural pathways, and see how they connect and make sure that we can plan the best surgery for them with this new type of imaging. There are many others. That's one of the key ones I wanted to highlight today. Others are starting to get really precise now, coming back to the precision medicine idea. We're starting to see imaging approaches where we have markers that are connected, if you like, or tagged onto certain proteins that are capable of binding onto specific cells, for example, cancer cells. And then when they bind, then they're able to be imaged medically more efficiently. So you can design a medical imaging strategy that uses these markers to identify very specific areas of the brain or other parts of the body that need to be targeted. So these targeted imaging therapies are also coming through. And they're really exciting because, again, it's leading us towards that future of precision and allowing us to be really accurate in our diagnostics.
That's really cool that they're doing that. I mean, all of the research that's coming out with precision medicine, just as kind of like an overall field, is so interesting to me. I'm going to pivot the conversation just a little bit.
Sure.
Prior to today, we discussed the importance of sleep. And I know that over the last several years, there's been a lot of people saying, the number one thing you need to do for wellness is sleep. You mentioned observing how exercising today can impact sleep patterns weeks later. How did your team track these kind of subtle delayed changes in the brain's physiology? And how are you tracking sleep and understanding the importance of sleep as well?
Well, that's a great question, and absolutely right. What an exciting hot topic of the moment. Sleep studies are everywhere, and I'm thrilled because I have no doubt, as someone who is a staunch advocate of brain health, that sleep holds the key to so much wellness within our brain. I'm a true believer, and that's coming from a background of neurosciences for the last almost 20 years now, as you say. Our research, I must be clear, I'm not a sleep scientist, and there are many who know more about the sleep space of research than I do. But my understanding as a neuroscientist is as follows. So what we're doing in our research, I mentioned earlier this idea of precision neuroscience, where we're studying one individual in detail at multiple time points over time. And you're right, we're not just looking at their brain in isolation. We're collecting simultaneously at the same time metrics regarding their sleep patterns. And we're doing this again with wearable technology. There are many different devices out there in the consumer space, but also in the research space that are allowing us to monitor different patterns of sleep, different types of sleep, and even some devices, we're not using these, but some devices that can look in true detail at how different brainwaves change in different areas of the brain in relation to different sleep habits and sleep situations, if you like. Super exciting. I've got lots of friends and colleagues who are involved in that space. But our research with, again, Dr. Anna Triana and colleagues, we are looking at one individual over time and monitoring the sleep with the wearable technologies, collecting a lot of raw data and using advanced data science to then plumb that into our analyses. And our analyses are showing us, well, how do changes in sleep over here affect the brain activity, or how are they related? We can't necessarily get causal relationships. We can't say for certain that if you have this is causing this, but we can start to delineate really detailed associations, correlations, if you like. So therefore, we've combined all of this data over a very long period of time. So in the recent publication that we talked about previously, that was published last year, and that was essentially a very, very long study over a few months, where Dr. Anna Triana, who was the subject herself, was monitored with wearable technology. Her physiology, her environment were being studied. She had multiple brain scans every month or for several months. And consequently, we were able to draw correlations between changes in brain activity that are likely to be associated with, for example, a bad night's sleep, potentially over a very long period of time. In fact, we were even surprised by the data because it showed us that sometimes a bad night's sleep 2 weeks ago can potentially impact on brain connectivity 15 days later, which is madness. I mean, one would never have guessed that if we are sleep deprived in one time in our life, that potentially that could be involved or at least associated with changes in brain connectivity or brain activity at a later date. Now, I must be clear, these studies are relatively in their infancy. The whole space of precision neuroscience is very, very new and has only really been about in the last few years. But I think it's extremely exciting to think that if we can see changes in brain activity and correlate them with what was going on in that person from a sleep perspective, or in terms of their heart rate, their breathing rate, their blood pressure, look at these physiological metrics and say, hey, hang on a second. If this person is showing signs of health concern, if this person is showing health concerns at one stage, and yet that we can predict how that will affect their brain activity later, I think those are very powerful correlations for the future of research, but also ultimately, as we mentioned earlier, the opportunities for precision neuroscience in clinical practice.
Something interesting that I've been reading about recently is the fact that women actually need more sleep than men do, based off of some of the studies that have been coming out, which I was shocked by, because I always kind of prided myself on the fact that I can function very well with little sleep. And, I think a lot of parents feel that way too. You're kind of just getting by, right? Something that I wanted to highlight is, your research specifically highlights gender-based differences in brain injury response. And I mean, as somebody who has suffered a brain injury, I think that's kind of personally interesting to me, but it's also interesting because I remember being told when I was recovering from my brain injury that women often present differently. They often have longer recoveries. They have longer lasting symptoms. How should some of these treatment protocols for things like concussion, TBI, other types of brain injuries evolved to reflect gender-specific differences that we need to do to ensure recovery?
Yes, it's a great question. It's a really great question. It's a very hot topic for good reason, because again, we can't treat everyone the same way. We're all very different. And I think, yeah, fundamentally, biological sex differences between people will have to be considered. And that's emerging evidence from emerging research. I must confess, I haven't any myself directly published in this field, but it is, as we discussed, an area that I'm fascinated by. Because as you've probably noticed, I'm someone that leans towards the individualized approach. And I'll come and sort of highlight that a little further. In terms of sleep, yes, there's lots of research coming through to suggest that we all sleep differently, but there are indeed sex differences between men and women specifically. That's a massive field. It's a little bit beyond my expertise. But let's just say watch this space. I think we're going to start to get enough of a consensus on the sleep research quite soon, such that we'll be a little bit more sure of how much sleep clinicians do or don't recommend, or how to help people with sleep disturbances and so on. That's very much beyond my personal expertise, but I am optimistic again for that space continuing to provide. Now, in terms of recovery from brain injury, again, it's an emerging field. When I started doing brain injury research back in 2006, I wasn't aware, I mean, it may have been happening, but I wasn't really aware of much research in the space of what are the sex differences in brain injury outcomes. Now, this is actually surprisingly difficult to study. And the reason for that is when you look at all the different studies that have been done on comparing sex differences in brain injury outcomes, the different studies might look at, for example, different outcomes. So they might look at it from a mental health point of view. They might look at it from a physical point of view. There may be, for example, focus on outcomes related to improving movement or improving speech or improving sensory perception. And therefore, unfortunately, there's a lot of variation between the different studies that occur, which means even though I've read recently a review on this very topic, it was published in 2022, so quite recently, it highlighted that there's a lot of a difference in the research. If we look at lots of individual studies and then review them, as this review did, we can see that there's a lot of subtle variation between the different studies that have been done, the way we look at these outcomes and then compare between men and women. But what has been shown so far is fascinating. And I think we're, again, at a very early stage. So we're not yet ready to deploy strategies that are sex specific. But some of the things that have come out so far, for example, women may have worse outcomes in some studies with some of the smaller injuries, for example, a concussion. There may be a more significant mental health impact for women than there may be for men. Again, very hard to generalize these two massive categories. I'm sure age plays a role. I'm sure other biological demographic factors will play a role as well. But interestingly, some studies have shown that after a severe brain injury, women are more likely to survive. Who knew? So again, emerging evidence, that's not something that's concrete quite yet. This is research that's just coming through. We don't yet have a consensus, but I find it fascinating that some studies have started to show this effect. So where do we go from here? Because essentially we've got mixed information, mixed messages. It's very difficult to study. Even if we review all the literature, as one review did in 2022, we can see that there's a lot more to understand, a lot more to plug and play and figure out. But ultimately, I personally carry the philosophy based on my clinical practice and based on my research experience, and I'm sure based on what you've seen yourself and experienced yourself, is that whatever we do with regards to brain injury recovery, it has to be an individual, tailored approach. The moment we start to categorize too much to say, well, this is what happens with any category, whether that's older adults, children, men, women, however you want to slice the pie, I think it's crucial to say, look, brain injury is unique to every unique individual, and optimizing brain injury recovery and outcomes requires a tailored, bespoke, individualized response. And that's really one of my messages, is that I think whatever happens when it comes to the brain, we need to think about the individual, we need to think about their environment, and, or of course, the people affected, not just them, but the people around them that have been affected by this injury and the consequences of this injury as well. So I'm a strong advocate for the individualized approach. Of course, it's very, very difficult to study individuals, every individual, of course. But I think it's important when we look at this sort of research is to say, well, hang on, let's remember every brain injury is unique.
Envision the integration of precision medicine, neuroscience, and the kind of individualized care being adopted into wider healthcare systems such as the NHS?
I think I'm sad to say that it's quite a long way off. I think it's going to be something that comes in the far distant future, perhaps even beyond my career. And the reason for this is, of course, it's extremely resource heavy to be able to do what we did with Dr. Triana, where we looked at one individual over a very long period of time in very much detail, and we looked at many different metrics. Of course, it's just not possible currently in any healthcare system to do all of that in one individual. And the reason we're doing this in the research phase is to be able to develop the techniques and to create new opportunities to be able to hopefully work towards a future where we have more precision. In terms of deploying that within a large healthcare system, such as the National Health Service here in the UK, it's fraught with challenges. As hinted at earlier, the systems, the complexity of those systems and trying to integrate novel approaches is going to be very, very challenging indeed. Not only from a resource point of view, but just from a systems point of view. Like, how does one start to integrate these approaches? How do we find out the changes in functional connectivity in all of our patients? It's very, very challenging. So I must stress that the precision neuroscience we're currently working on is really a way of developing our understanding of the brain, but that in itself will hopefully lead to more therapeutic opportunities as we have discussed. So I don't see it coming into the NHS anytime soon. I do hope, though, that elements of it might. So, as with all precision medicine and preventative medicine, we may, from the kind of research that's going on now, both myself and others are involved in, we may start to find that there are certain elements of that kind of research that we can pull in. Not necessarily the entirety of precision neuroscience, have a really deep, thorough understanding of all areas of the brain, but perhaps we identify something that can be relevant not just to the individual, but can also be applied at scale. A discovery that allows us to perhaps indeed predict those who are more likely to develop a certain condition. And perhaps that would come about from the data that's done the data that's created during the research phase. So if the research that we're working on now leads to enough of an association or a correlation that we can then perhaps apply one or two tests to our patients, I would hope that would be a route in for this kind of neuroscience to get a foothold and some traction within much broader healthcare systems. But it's not there yet, and we're working towards it, of course.
It always takes a while. It's always that, the evidence-based practice word that always comes up when you're trying to implement new technologies. I do have one last question for you. If you could change one cultural aspect of healthcare around brain injury today, what would that be?
It's a great question. I think the big one I've hinted at already, but let's just clarify. I think often in medicine we have a bit of a one-size-fits-all approach because we develop guidelines. And I think that the key message there from me is that absolutely we must be robust. We must conduct research and clinical practice with the utmost integrity to protect patients. That's a given. That means we need to look at the safety and efficacy of our therapies, our technologies in very much detail. And I'm a strong advocate for that. That's just been the way I've practiced, both in research and clinical practice throughout my career so far, and will continue to do so. But I think what I would like to share, and the key message from me today, is that whether we're patients, whether we're relatives or friends, or whether we're clinicians or researchers, I think we must maintain that sense of brain injury and brain recovery being very individual. Yes, we can do studies which look at certain demographics, look at certain groups, and that will yield important information, undoubtedly. But when it comes to having that person in front of you that's been through probably the most catastrophic thing they'll ever experience. I think as clinicians, we have to remember that sometimes, we have to, and as relatives and as friends and as society in general, we have to remember that everyone's brain injury is unique to them. The consequences of that injury will be unique to them. And their recovery program, where possible, will have to be bespoke and tailored as much as possible. And that's very, very challenging in terms of shared resources in, for example, the National Health Service, for example. But I just want our listeners to know that when we think of brain injury, it's not just one entity. It's something very different for different people, and it presents in different ways, and it causes so many different challenges that we won't have even thought of. And I think my clear message today is that please remember that brain injury is unique to the individuals and the people around them.
Thank you for sharing that final message. I think it's extremely important for people to hear that. And thank you, Dr. Hayward, for your time today, sharing your time and your passion with us. It's been a pleasure to have you on the podcast, and I look forward to following all of your research in the coming years.
Oh, Catherine, thank you so much. I've genuinely enjoyed sharing what we do in our research and clinical practice over here. And yes, I'll continue to catch your other episodes because I'm really grateful that you're giving us voices in healthcare and bringing the healthcare innovations closer to society. So thank you for your time as well.
Thank you to all of our listeners for joining us on the podcast today. We appreciate your support. To hear from more healthcare voices like Dr. Nick Hayward, hit the subscribe button and share this podcast with your friends and family. I'm your host, Catherine Cummings, and you just listened to Healthcare Voices.